Now for tonight's climate check, with the city laser focused on environmental issues this week, we turn our attention to Doctors Without Borders and a closer look at what physicians on the front lines are seeing around the world during humanitarian efforts. For example, look at these images of a flood-ravaged community in Nigeria last week, where volunteers with Doctors Without Borders had to help patients after their homes were destroyed. Let's bring in Avril Benoît, U.S. CEO of Doctors Without Borders. Avril, thanks for being here.
Thanks for having me.
Explain for our audience how climate change is providing humanitarian assistance, and it's more difficult these days.
Well, the climate crisis is having impacts on all kinds of ways that we live in the world. And so when you have a humanitarian crisis happening, whether it's a war or difficulties for people who are on the move, you've got circumstances of an overheating planet. Some areas where we work, in more than 70 countries, we have operations. And in some places, it's becoming so hot that people can't grow crops. They can't feed their families. We have massive areas of flooding. Sometimes marshlands in South Sudan, for example, that are already extremely needy, are becoming almost permanently flooded to the point that our little hospital, which is on a small mound of land, is only accessible by canoe. You can have in an area like this a lot of vector-borne diseases, of course, because the mosquitoes that are carrying malaria and dengue thrive in these kinds of flooded environments, not to mention cholera and other waterborne diseases. So all in all, for the medical humanitarian community, we have seen that the climate crisis is real. It's happening now. It's not some future state. It's really happening now as a crisis in many parts of the world.
Yeah, it's happening in real time, and I'm so glad we're having this conversation, because this conversation is not one of the topics I'm hearing about at the United Nations. Now, some doctors with boots on the ground say the consequences of climate change are not distributed equally. Your thoughts on that?
Well, it's true. When you think of the great emitters of carbon, you've got the big countries like the United States, countries in Europe, China, etc. And where we're seeing the greatest impacts, although we do feel it here when we have a catastrophic flooding event in the subways of New York City, we're certainly feeling the effects when we have a huge hurricane, these random and extreme weather events. We realize that the climate is not doing well. You've got environmental pollutants, especially when we had those forest fires in Canada and all the smoke coming down. So we start to realize it's here. But really, disproportionately, we are seeing the effects in some of the low-income countries of the world, the countries that are already struggling to just run a government, let alone an economy, because of war and years of war in many instances. So we have Nigeria, the area that you spoke of with this horrific flooding. This is a part of Nigeria that has got a lot of conflict, armed groups clashing with the military. People are living in refugee camps, internally displaced people, and they are so vulnerable. They're fleeing to places where maybe the water is contaminated, if there's water at all. There's very little assistance that can reach them in rainy season because everything is flooded. It's impossible to bring the cargo trucks in with all the humanitarian aid we need. So that's why for us, there is a sense of climate injustice insofar as these countries are feeling the brunt of our emissions in countries like the United States.
Sure, and I have 30 seconds. Let's quickly talk solutions. What do you make of the global response to climate change, especially as it relates to the volunteer work of doctors?
Well, look, we're doing our best to respond in real time to the effects, but I think what really needs to happen is for all of us around the world to take seriously the effects of environmental degradation and the climate crisis. It will affect our own health. It will affect the health of people around the world. And so it's important for all of us to pull together, and we know what to do. We know what the policy options are and the individual choices are to help reduce some of the rapid temperature rises that are bringing a lot of this into fruition and making it such a horror for people around the world.
And it is a horror. Avril, Benoît of Doctors Without Borders, appreciate your time tonight.
Thanks for watching our YouTube channel. For more stories in your communities, click the subscribe button right here. You can also download our app or watch us on TV for the latest news and weather updates every 10 minutes and more. We'll see you then.